Well, so welcome back. Of note again is for this virus, studies are underway. We've not gotten vaccination for this virus. That is what should be known, and you should not be cheated. Then there is no treatment. What is being done is what you call supportive treatment. There is no specific treatment. A lot has been tried, including use of antiretroviral drugs, but what is being done for cases that have been confirmed is actually what we call supportive treatment. And so, what you also need to know is, this virus, once you get it, there are some, and you see there's a case definition. Case definition is what we mentioned earlier: cough, runny nose, fever, and then to actually strengthen on our case definition is anyone who has traveled from the affected countries like China, Italy, or maybe you've been in contact with someone who traveled, then that strengthens our case definition. So that calls for emergency action. You need to go to a nearest facility and so that you can be quarantined or isolated, and so that they organize for testing. Remember, this virus, not every lab is testing. It's a highly contagious disease, and so it's selective. The only level 4s and above selected designated laboratories that can handle those samples. Because you see, if they leave it to every other laboratory, then it's going to infect people. So they're just designated laboratories that are doing this testing. Some of the samples that are being done are like the nasal swabs, the nasopharyngeal swab, the bronchoalveolar lavage, and even serum or blood testing is also being done. But remember, once you call, and so you'll actually be helped to be able to conduct those samples. So treatment, we say, is not treatment. Supportive treatment is what is being done. If you have fever, you'll be given fever relievers or antipyretics. If you have you are developing difficulty in breathing and your oxygen saturation is being too low, maybe less than 90, you'll be put on oxygen in severe cases. And if you're also given hydration, because you see, if you're having difficulty in breathing and a lot of humid air is coming out, you're going to be dehydrated, and the system is going to be dehydrated, so you need to be hydrated. And so in some cases, they're also giving immunoglobulins just to support the immunity. So those are some of the things that you need to know. There's no specific treatment, and then there's no vaccination. As of now, studies are still underway. So how do we prevent ourselves from catching this virus? How do we prevent ourselves from catching this virus? Number one is if you suspect that you could be having it, by having a cough or runny nose or those symptoms that we mentioned, then quarantine yourself. Stay away from the general public. Stay away. And that's why we are saying avoid unnecessary gatherings. Unnecessary gatherings, avoid them. I'm going to the movies, I'm going to the club. Those ones we are actually discouraging. Number two, sanitize yourself. Frequent hand washing using soapy water. If you have sanitizers with alcohol-based content, then that will also come in handy. So, and then what we're also advising is don't shake hands. We are not shaking hands in this era of coronavirus. It's quite unfortunate that people are friendly, but let's avoid shaking hands. So just wave or just find a way of saying hi to someone without shaking hands. If you're coughing, we say if someone has a cough, always keep a distance as we talk to them. And then if you don't have a handkerchief, we are always recommending that cough in a handkerchief. But if you cannot, then cough in your arm. Cough in your arm. And then what we've also noticed in the country that is still happening and we are discouraging is these hand-free microphones. People are talking, at least there are people talking here and there and giving briefings, and people are actually using microphones and moving. I use a microphone, someone else comes in and also uses a microphone. So those ones we also try to discourage, unless we have those independent small microphones that people can use. So as we finish, we want to let people know that it's a disease that is actually highly contagious, but the mortality cases are low. So it's not actually a sentence to death. The majority of the people that are affected are above 60 years and above, and people who have comorbidity illnesses like diabetes, hypertension, HIV illnesses, but generally people can survive with this illness. Once you notice it, then rush for medical assistance. call the toll lines that have actually been put, and you're going to really be helped. So thank you so much. Welcome to Rapid Telemedicine. We don't necessarily only handle COVID-19, but we even handle other medical, surgical, obstetric, gynecological, and pediatric cases. Thank you so much, and be blessed and be safe.